check the diagram. It's clear, right? If a part or all is missing, that's the difference between dementia and forgetfulness. This is Dr. Mandarin, wishing you a healthy, happy life. This time, I'll talk about the early symptoms of dementia, a simple screening test, and the methods of diagnosis, explaining them briefly from a doctor's perspective. This video is for people who are wondering if they might have dementia, and for family members who are concerned about their loved ones, like their husband. I'm making this video for those who are worried that their father or mother might be showing signs of dementia. By watching this video, you'll learn what the early symptoms of dementia are, how normal forgetfulness is different from dementia, and I'll also introduce a simple screening test that you can do in about 5 minutes or even 1 minute. There's a simple screening test, so with that, I think you'll be able to easily judge whether you should go to the hospital or not. I'll also discuss the types of diagnoses doctors make. I'll also explain whether you should go to the hospital, what happens if you do, and what kinds of diagnoses there are and whether some conditions can be treated. I'd like to briefly go over those points. Alright, let's get started. First, let me say this up front. I think the term dementia prevention will gradually stop being used. What I mean is, when it comes to dementia prevention, you often see things on TV like exercises to help prevent cognitive decline, right? But that means we're doing those things so we don't get dementia, right? But that's not it. Dementia is something that's being talked about in this age of the 100-year life. As people keep living longer, everyone will experience senility. Even I will become senile in the future. And if you live a long life, I think you will too. So about 40% of people in their 80s have dementia, and for people in their 90s, about 60% have dementia. In other words, more than half of them have dementia. That just means it's a result of living a long life. So anyone can get dementia. That's why it's okay to be optimistic and just say, if I get dementia in the future, please take care of me. If you start thinking that you have to work hard to prevent dementia because getting it is bad. For example, if you start to become forgetful yourself, or if your mother starts to become forgetful, you might try to hide it and insist, I'm not forgetful, and work hard to cover it up. But as you do that, you gradually become less able to do things, and family relationships can start to deteriorate. These kinds of things can happen. Instead of focusing on preventing dementia, we need a society where we live together with people who have dementia. That means, rather than trying to cure dementia after someone gets it, since anyone can develop dementia, we should create an environment where people with dementia can live more comfortably. By learning how to interact with people with dementia and understanding its characteristics, we can make life more comfortable for them. Dementia isn't something you just prevent. It's something that can gradually happen to anyone, so it's important to slow its progression. Instead of focusing on not getting it, if you do develop dementia, then the goal should be to slow its progression. It's important to pay attention to things like blood pressure and smoking, so please make sure to keep that in mind. Now, let's get into the main content. I'd like to do a quick dementia screening. Alright, I'll demonstrate first, so please try to do it just as I say. The first test is called the finger imitation test. First, please make an OK sign with both hands. Did you do it? Next, make a fox shape with both hands. Did you do that too? Now, put the foxes together so that the ears touch like this. And finally, turn them around like this. Put the ears together like this. Did you do it? This is the finger imitation test. Easy, right? Try doing it like this, and if you can do this test, the suspicion of dementia will be greatly reduced. If you can do this test and you're not having any trouble in your daily life, then it's probably just age-related cognitive decline, or at most, the very early stages of Alzheimer's type dementia. Basically, it may not be time to consult a hospital yet. It might not be the right timing. However, just because you couldn't do the test I mentioned doesn't necessarily mean you have dementia, so it's not definitive. This is a simple test that, if you can do it, I think it means you don't have dementia, so please give it a try. Make an OK sign, make a fox, switch hands and put the ears together, and finally flip it over and put the ears together again. That's the kind of test it is. Now, let's try another slightly more detailed test. It also takes about 5 minutes, so please try it. First, get some paper and a pen, or your iPhone. You can also use the doodle feature on your phone, so have it ready. I have 3 tasks for you now. Alright, let's get started. First, cherry blossom, cat, train. Cherry blossom, cat, train. Please remember these 3 words. Next, please prepare a piece of paper and a pen. Draw a clock showing 11:10, draw a circle, and there should be an hour hand and a minute hand. Where do the hands point at 11:10? Pause the video if needed and try drawing it. Now, the final question, say the 3 words I mentioned earlier. How did you do? Could you say them? What this test can tell us is that if you can't say all 3 words at the end, there is a higher possibility of dementia, so I recommend that you see a doctor. And if you can't draw the clock and also can't recall the words I mentioned at the beginning, like cherry blossom, cat, and train, if you only got 1 or 2 correct, there is also a possibility of dementia. Please consider going to the hospital. How was it? It was simple, right? On Dr. Mandarin's channel, we share easy-to-understand information for the general public from a doctor's perspective in a fun way to help you stay healthy. So please subscribe to the channel and don't forget to hit the like button. I think this is the part everyone is most curious about. What are the early symptoms of dementia? I'll explain this in detail. And the most important thing is to distinguish between mild age-related forgetfulness, which can happen to anyone, and dementia, so I'll clearly explain the differences there. The first point may seem self-serving, but it's easy to understand. Think of this as memory. There's the present, and memories from the past stretch out like this, but people gradually forget things starting from older memories. For example, not being able to remember what was in the miso soup you had yesterday. Well, I think that's just normal forgetfulness for your age. What I mean is, you remember eating the miso soup, but you just can't recall what ingredients were in it. Like, you don't remember that part? And then people around you might say, what, you don't remember? When someone says, we bought it together when we went shopping the other day, then you go, oh, it was Nameko mushrooms, that's right. If someone tells you, you remember, and you can even recall the situation. That's what normal age-related forgetfulness is like. On the other hand, when the entire memory, like having drunk miso soup, is completely missing, that's typical of dementia. Even if you say, you ate Nameko mushrooms, right? They'll just respond, huh? They'll be like, did I drink miso soup? Or I didn't eat anything like that, and that's what happens with dementia. Well, if you look at it in a diagram, it's easy to understand, right? Whether a part is missing or everything is missing. That's the difference between dementia and simple forgetfulness. Another characteristic is that people who come to the clinic saying they're worried about forgetfulness are basically less likely to have dementia. However, if it's the family who says they're worried about someone's forgetfulness, then the possibility of dementia is higher. What this means is that many people with dementia are not aware that they're forgetting things. Some people may get upset and insist, no, I didn't forget. They don't recall drinking the miso soup, so they aren't aware they've forgotten. This is characteristic. Another feature is covering up, which appears in conversation. For example, if you ask, do you remember what we talked about at your last clinic visit? They'll say, yeah, I remember, but they actually don't. That's another way of covering up. Also, when I'm with a patient and their family is behind them, I might ask, how did you get to the clinic today? When I ask that question, sometimes the patient will turn around and try to get their family member to answer. Since they don't remember themselves, they try to have their family answer for them to hide the fact that they've forgotten. There are also things like this head-turning sign, which can be a characteristic of dementia. With simple forgetfulness, people can typically live as usual, aren't bothered by it, and it doesn't worsen. Some have worried about their forgetfulness for 5 years. It hasn't really progressed much. For some, it's just normal forgetfulness, but for people with dementia, things gradually, it starts to interfere with daily life, and that's actually one of the diagnostic criteria for dementia. So if your daily life is being affected, you should definitely go to the hospital for a checkup. And it's progressive, you know, usually within about 1 to 2 years, you might notice that the dementia has progressed a bit, so please keep that in mind. For example, if the symptoms of forgetfulness progress rapidly within a few days, we would consider other illnesses. But with dementia, it usually progresses slowly over 1 to 2 years, and after 5 years, you'll notice that things are completely different compared to 5 years ago. Please also remember that this is the kind of pace we're talking about. Now, one of the heartbreaking symptoms of dementia is what's called paranoid delusions of theft. Let me explain this. For example, they might say, where did you put my wallet? You took it, didn't you? And really wonder why this is happening to them. It's heartbreaking to be accused when you're working hard to care for them. This is one of the most painful symptoms. But actually, if you try to imagine the world of someone with dementia, these paranoid delusions of theft are somewhat understandable symptoms. It's because the person is important to them that they might mistakenly think something was taken. So please, just keep this in mind. This is actually the flip side of them thinking, I'm okay. People with dementia often don't realize they have memory issues and might think, I haven't forgotten. For instance, they may hide money to keep it safe, then forget where they put it. Later, when they look in the usual spot, it's missing. It's not in the usual place. The memory of where they put it is completely gone, so it's not in the usual place. In other words, the only people who know where the wallet usually is are those close to them, the ones who always take care of them. They end up saying, "It was you, wasn't it?" and accuse those close to them of taking their things, but never ask a complete stranger, "Did you take my things?" I want you to understand that point, and I'll be posting a video on how to interact with people with dementia in the next video, so please subscribe to the channel and turn on notifications. I'll add the link in the description after the video is released, so check it out. Lastly, let's talk about the diagnosis. This video is intended for families and the person themselves. The most important thing I want to say is, if you have a primary care doctor, consult them. Please talk to the doctor you usually see. You can also consult with the Community Comprehensive Support Center. It's okay to just call. If you're worried about your own forgetfulness, or if a family member is concerned, it's fine for them to call too. Look up your local Community Comprehensive Support Center online and call their number. I think you'll be connected to a dementia consultation service, so please give them a call. If you're wondering what other ways there are to diagnose dementia, I run a YouTube channel called YouTube Medical University, so I'd like to share more information there. Please subscribe to the channel from the link in the description. Now, as for diagnoses that should be distinguished from dementia, I'll explain one in detail here. It's called pseudo-dementia, or false dementia. In fact, depression in the elderly can resemble dementia, and sometimes they can occur together. So what are the dementia-like symptoms caused by depression? They lack motivation, right? Even if they want to act, they can't, or their low mood can make it seem like they have dementia. For example, if you ask them what they want for breakfast and they just go silent and say they don't know, that could be due to dementia, like they're forgetting things. It's not a symptom, they just lack motivation. They don't even want breakfast. Another important thing is, well, if it's just simple depression, they tend to view their own forgetfulness in a very pessimistic way. They might think things like, "No, I'm really hopeless now," or "I'm just going senile and waiting to die." There are people who get depressed like that, and that's one of the characteristics of pseudo-dementia. Sometimes using antidepressants can help improve their condition, so it's really important to go to the hospital. Other than that, there's also vascular dementia. There are also conditions like Lewy body disease, an underactive thyroid condition, and cases where a hematoma forms in the head, pressing on the brain and causing dementia-like symptoms. With things like thyroid disease or a hematoma in the head, if you remove the cause, those dementia-like symptoms can sometimes be cured. That's why it's such a specialized field. When dementia is suspected, it's essential to go to the hospital and get a proper diagnosis. For example, applying for long-term care support and attending an adult daycare program becomes important after that. In order to create an environment where people with dementia can live comfortably, it's not just the family who should work hard, but the whole community needs to support them. How do you apply for long-term care support? What about driving? What about money? How do you manage medication? I'll be posting videos about those topics after this, so as I keep saying, I'd really appreciate it if you subscribe to the channel. I forgot to mention this at the end, but I'll also be uploading videos about dementia medications on the YouTube Medical University channel, including how to use different treatments and information about the new drug that's come out recently. I'll be sharing my thoughts on that new medication as well, so please be sure to check out the YouTube Medical University channel. And one more thing, for families who are really struggling with whether or not to tell their loved one about their dementia, or for those whose loved one doesn't understand their dementia or won't cooperate with the nursing care assessment, I think there are a lot of people in that situation. If you have anything you'd like to discuss, please leave a comment in the comment section. I'll make sure to reply, so I look forward to hearing from you.